Thank you, Madam Chairman. Just a couple of thoughts. One, it's been 2 hours since we've been here. It's one of the people at the low level here out in the hinterlands. Just a couple of thoughts. One, I think it would be helpful if and please excuse me for this comment, if the chair and ranking member limited their opening comments to the 5 minutes, just like you expect those folks to limit their comments to 5 minutes. We didn't get started until 25 minutes after asking these folks their questions. I do want to note also that in this process, as I'm sure you who are testifying here today recognize, that some of what we do is performing, and some of what we do is to become informed. And I do both from time to time, so I'm not just in one camp or the other in that regard. But I do want to point out how much I personally, and I believe the great majority of the people in our country, respect you individually and professionally for the work that you do. You are scientists, not politicians. Nevertheless, you are being made subject to the political whims of various political individuals, and that comes at a high cost, which unfortunately I fear will lead some to not want to participate in helping our government make scientific choices. But I very deeply appreciate your commitment to the American people and your desire to do things as well as we possibly know how to do. That doesn't mean they will be done perfectly. That doesn't mean you won't make mistakes. Doesn't mean there won't be changes from time to time. Sometimes as data comes in that's different than what you had anticipated. And sometimes just because you were wrong. I mean, it's the nature of being a human being. That's where we are. I think, unfortunately, the administration was wrong in not building testing capacity at a time when we all thought COVID was kind of going away. I remember the summer and the fall, going into a grocery store, into a drugstore and seeing 2 rapid tests on the shelf, and those things stayed there for days. No one was interested in buying a rapid test. And apparently the administration didn't think that it should be aggressively building rapid tests. Omicron came along, caught people by surprise, and we were obviously badly mistaken. The administration was, and we're suffering in part because of that. Let me ask, with regards to Paxlovid, Ms. O'Connell, is that being subject to warp speed? My understanding is that Paxlovid is far superior to other oral antivirals. Should we not be much more aggressively producing that and getting that out such that it can be prescribed?
Thank you, Senator Romney. We're in active conversations with Pfizer about how to increase their time limits. My understanding, and the scientists on the panel can feel free to jump in, is that the process required in order to generate this particular antiviral is months long. It's a chemical process. It's one that's very, very hard to accelerate. What we have been able to do is to find additional doses, to work with Pfizer to try to unlock additional capacity where they can find it. And we're continuing to do that actively.
Thank you. Dr. Walensky, good to see you again, and appreciate the chance we had to speak earlier this week, or last week rather. As I've looked on the CDC's COVID tracker report, I note the data goes through November 20th, and I remember my days in business, if we didn't have daily information, we couldn't make good decisions. And I wonder, do we need to invest in either developing a new sub-agency or a task force to get basically on, immediate data, daily data, so we know what's going on? And that's not just for the public, that's for those of you who are making those decisions. Do we need to do a much better job moving faster, getting data?
Senator, first of all, let me thank you for your earlier comments, but also to comment on our COVID data tracker. I think you're speaking to the 27 jurisdictions that we now compile data that allows those jurisdictions to report together their testing data, their cases data, their immunizations data, their age data, as well as their death data. It's over 2/3 of the country that we do, and we update that about once a month, and it's about 3 or 4 weeks in arrears. So mid-January, we will be having data through the end of December, and it simply does take that long for our jurisdictions to compile those data. And of course, our death data are generally lagging. It takes a while for those to get reported and adjudicated. So we're now updating those. They're about 6 weeks in arrear, and we're working hard to keep those in real time.
Yeah, I know retailers like Zara, for instance, they apparently get data and correlate it daily. So I'd hope we could find a way to increase the speed with which we get that data. I know my time is up. I'm just going to make a comment, and that is that I think it'd be helpful if people knew when they should get tested, when it's called for, because I think a lot of individuals, myself included, get tested when there's no indication that I need to get tested, other than just want to make sure I'm not sick. And there's huge demand for tests, which are in short supply in part because of that. And number two, when you say when people have been exposed, please let us know what it means to be exposed. We're in a room right now. I'm sure someone here has Omicron. Are we all exposed and therefore need to get tested? What does it mean to be exposed, and when do we need to get tested? I know that I wanted to ask that of Dr. Fauci. I can't do that given my time.
Senator
But those are
Romney,
topics I'd love to have
Senator Romney,
elaborated on.
I think
Thank
that
you.
is a question we all want answered, and I will give Dr. Fauci the opportunity to respond to that.
Dr. Fauci?
Well, the CDC guidelines make that very clear, and it is if you are exposed to an individual with known, if you are in a period of 15 minutes at a time or a total of 15 minutes over a 24-hour period in a situation where you come into close contact. Perhaps Dr. Walensky could expand on that, but that's the fundamental core of the CDC guidelines.
That's exactly right in terms of the definition of exposure. In terms of who should get tested, you should get tested if you have symptoms of COVID-19. If you do a rapid at-home test and you continue to have symptoms and that test is negative, you should do another test or get a PCR. You should get tested within 5 days of your exposure or after 5 days of your exposure with the definition that Dr. Fauci mentioned. And, we're testing through test to stay and other mechanisms as well. So many reasons to test, but really most importantly, if you are exposed, if you have symptoms, and also if you're going into a setting where you might be seeing an immunocompromised person, somebody who's vulnerable, not able to be to take a vaccine.
Thank you very much.